So when you think about medical tourism, you probably picture someone from the U.S. heading overseas, right?
Yeah, exactly. Maybe Mexico for dental work or somewhere else for cheaper cosmetic stuff. That's the common idea.
But here's the twist we found in the sources. There's this massive multi-billion-dollar medical tourism market actually happening right here inside the U.S.
And it's interesting how the sources define it. It's really broad. Medical tourism isn't just crossing international lines.
Oh, right.
Yeah, it's basically seeking healthcare beyond your usual geographic area. So that could just be the next county over or another state or, yes, another country.
So it's about traveling for the care you want.
Exactly. The care you want, the price you want, when you want it, where you want it, and crucially, at the level of quality you're looking for.
You know, it's funny, the term medical tourism actually fits quite well.
How so?
Well, the material we looked at pointed out that people coming here, especially internationally, they often do mix in regular tourist activities.
Ah, okay. So while they're here for maybe weeks or months for treatment, they might check out local sites, eat out, that kind of thing.
Precisely. It blends the medical need with being a visitor.
Makes sense.
So for this deep dive, we've gone through some really interesting source material, specifically some video excerpts looking closely at the U.S. market. And they focus quite a bit on a major hub, Houston, Texas.
Right. And what we're going to unpack is, well, first, just how big this market actually is and how fast it's growing.
Okay.
Then, who exactly is traveling both out of the U.S. and into it, and the very different reasons why.
And specifically for a place like Houston, what makes it such a magnet?
Yeah, the ecosystem there, how they support these patients, the logistics involved that go way beyond just the hospital room.
And the money, right, the economic impact.
Definitely. That's a big piece of it.
Okay, let's start with the size then. How big are we talking for the U.S. market?
The sources put the value at $4 billion back in 2021.
$4 billion. Okay, that's already substantial.
And it's not stopping there. The projection they cited was for nearly 33% growth between 2022 and 2030.
Wow, a third bigger in less than a decade. That's serious growth.
It really is. It makes it a significant economic driver, not just some niche thing.
And the sources mentioned revenue specifically from foreign patients could be, what, maybe upwards of $1 billion nationally?
Potentially, yeah. And that number includes everything, not just the medical bills. It's the hotels, the food, transport, everything else they spend while they're here.
And in Houston alone, it's already hundreds of millions.
Big numbers.
So who are these people traveling? Let's break that down. Maybe start with Americans going out. Why are they leaving?
Well, the number one reason seems to be cost, plain and simple.
Cheaper elsewhere.
Significantly cheaper sometimes. The sources mention procedures costing less in another country than maybe even your insurance deductible here in the U.S.
That's a powerful incentive.
Absolutely, and it connects to something else the sources touched on, this perception maybe some Americans have that healthcare quality outside the U.S. isn't as good.
Yeah, a bit of a provincial view, as one source put it.
Right. But the reality highlighted is that there's excellent healthcare available globally, often, at a much lower cost.
Okay, so cost is number one. What else drives people out?
Fewer restrictions sometimes. Things like age limits or maybe BMI requirements for certain surgeries might be less strict in other countries.
Gotcha.
And the sources also noted, neutrally observed, that since Roe v. Wade was overturned, some people are traveling to other countries for procedures like abortions where they were still legally available.
Right. That's another factor now. And what kind of procedures are people typically going outbound for? I think many assume it's mostly cosmetic.
You'd think so, but actually no. The source data showed cosmetic surgery is only about 13%.
Oh, really?
Yeah. General surgeries are more common, around 30%. But the biggest chunk, surprisingly, dental, about 50%.
Half of it is dental. Wow, that's unexpected.
It really is. And it's not just surgery. Think about pharmaceuticals, too. Remember the Ozempic shortages? One source cited a study showing 10% of Ozempic prescriptions filled by Canadian pharmacies during that time were actually for U.S. residents crossing the border or ordering online.
Just trying to get access when supply was tight here.
Exactly. Okay, so now let's flip it. What about people coming into the U.S., especially into hubs like Houston? What's their story?
Are they different from the outbound travelers?
Generally, yes. The sources suggest inbound patients tend to be more affluent.
Okay. And the reasons for coming here? Probably not cost saving.
Definitely not cost savings. They're usually coming for really complex medical needs. The sources describe patients often arriving in, frankly, desperate shape,
Meaning?
meaning they might have had surgeries fail back home or they have conditions that local doctors just couldn't handle. They're traveling sometimes thousands of miles seeking very specific, high-level expertise.
So it's about accessing a level of care or specialization they can't get otherwise? High acuity cases.
Exactly. High acuity, severe, complex cases. And here's where the pandemic comes in, according to the sources.
How did COVID affect this?
Well, the argument is that the pandemic essentially made the world sicker. People put off routine checkups, preventative care, even treatments for existing conditions for, a couple of years.
Right, because hospitals were overwhelmed or people were afraid to go.
Exactly. So now, when these people finally seek care, their conditions are often much more advanced, their acuity level is higher.
And that drives demand for specialized centers.
Precisely. One source mentioned the American Medical Association finding that U.S. hospital bills went up about 10% post-pandemic, not because of inflation primarily, but because patients were just sicker on arrival, higher acuity.
Okay.
So you have this global backlog of complex needs, plus people presenting later with more severe conditions. It creates what the source called a perfect storm for growth in this kind of high acuity medical travel into places like the U.S.
Which explains why Houston is such a key player. It has the facilities for that complex care.
It does. Houston's built this global reputation. The sources say it's known internationally for two things mainly: energy, oil and gas, and healthcare.
The energy connection is interesting. Does that influence where patients come from?
It seems to. It makes Houston a sort of natural hub for patients coming from energy-linked regions, Central and South America, definitely the Middle East, and parts of Asia, too.
And at the heart of its healthcare reputation is the Texas Medical Center, the TMC.
Right. Described in the material as the largest medical center on Earth. Just this massive concentration of specialized hospitals and clinics. We're talking places like Texas Methodist, Memorial Hermann, all clustered together.
A cluster approach, the source called it.
Mm-hmm. And it's more than just having the hospitals there. What Houston seems to do really well is coordinate everything around the medical care, especially for international patients.
How does that work? Is it formalized?
Yeah, they mention things like an International Patient Advisory Council. It brings together all the different players.
Yeah.
Hospitals, obviously, but also city government, county, state, even federal agencies. Plus the chambers of commerce, the airports, hotels, restaurants.
So a really broad coalition.
Yeah, the goal is to make the entire experience smoother. They coordinate practical things like transport from the airport.
Okay.
But also things sensitive to the patient's backgrounds, like making sure there's access to halal food options for visitors from the Middle East, for example. It's about looking after the whole person, not just the patient.
That level of coordination highlights just how much more is involved than the medical procedure itself, doesn't it? The logistics sound immense.
They really are. Probably the biggest challenge for these international patients, as the sources point out, is simply not having their usual support system nearby. No family close by, no friends, no familiar community.
And they're often here for a long time, right?
Oh,
Just a few days.
Oh, yeah. We're talking weeks, often months, sometimes even up to a year. It depends on the surgery, the recovery needed, maybe follow-up appointments.
The sources gave that example of bariatric surgery patients, maybe like you see on TV shows, who need really long-term post-op care and have to stay near the hospital.
Exactly that kind of situation. And for those long stays, a standard hotel room just doesn't cut it usually.
Why not?
Well, think about needing home health care visits or physical therapy. Those services typically won't go to a hotel room. Plus, just for comfort and recovery, especially after a major surgery or even cosmetic procedures where you might need to rest in specific ways, you need more of a home-like environment.
Which is where these specialized housing providers come in.
Right. Companies that offer furnished apartments, corporate housing, specifically located near the medical center. The sources got some perspective from one of these providers.
And what do they say?
It was pretty eye-opening. They said at any given time, about 20 to 30% of their residents are international.
A significant chunk.
And overall, something like 80 to 85% of all their residents are there for medical reasons, whether U.S. domestic or international.
Wow. So their business is overwhelmingly medical-related stays.
Completely. And these international families often need bigger places, too. Not just a studio, but maybe 2 or 3 bedroom apartments because they travel with family members for support.
How do patients even find these places?
Various ways mentioned. Word of mouth is big. Online resources like Joe's House, which focuses on housing for cancer patients. Hospital social workers often provide referrals. Sometimes people literally just drive around the area looking.
And that housing provider perspective, it really added a human dimension, didn't it?
It really did. They stressed how personal their work is, the need for real empathy. They're dealing with people who are under incredible stress, facing scary diagnoses, far from home, maybe after other treatments failed.
Yeah.
They see it all in the successful recoveries, but also the really tough situations and difficult outcomes. It's clearly more than just renting apartments. It's being part of that crucial support system during a really vulnerable time.
Okay, let's loop back to the economics of all this. We talked about the market size, but the individual patient spending.
Right, it's significant. International medical tourists, according to the sources, spend way more per trip than regular leisure tourists.
How much more?
The estimate was around 10 times more. So, a leisure visitor might spend a few hundred, maybe a couple $1,000s. A medical tourist, with the cost of care plus the long stay, accommodation, travel for family, it can easily be tens of thousands.
And there's specific Houston data.
Yeah, for 2022, Houston had about 600,000 foreign visitors total. Over 20,000 of those came specifically for medical care.
Okay.
And the average amount they spent just on their inpatient or outpatient care, not counting hotels, food, travel, anything else, was $3,400 per person.
Just on the medical bill. So
Yeah.
the total economic impact per person is much higher.
Much higher. And this economic potential hasn't been ignored. The sources noted that even the U.S. government recognized this as a growing revenue stream.
Oh.
Yeah, mentioned that back in the Obama administration, there was a grant given to a group of academic medical centers called USKIP, specifically to help them market U.S. healthcare services overseas.
Interesting. So official recognition of this as an export, essentially.
Kind of, yeah. Exporting medical services.
So looking ahead, what's the outlook? Is this growth expected to continue?
All signs point to yes, based on the sources. There are a few key drivers.
Like what?
One is just increasing global wealth, particularly in developing economies. The sources mention the BRICS expansion, for instance. There's a pattern noted. As people gain more disposable income, they prioritize spending first on maybe education for kids, then lifestyle things like travel, and then, crucially, on better health care for themselves and their families.
So a bigger pool of people globally who can afford to travel for top-tier care.
Exactly. Plus, you still have those lingering effects of the pandemic. We talked about the backlog of care, the higher acuity needs, that demand hasn't gone away.
Right.
And then just basic demographics, population growth in key regions that already send patients here, like Latin America and Asia, means more potential patients down the line.
So the expectation isn't just growth, but strong growth.
That's the forecast, at least double-digit growth, continuing the kind of 10-15% annual growth trend that medical travel, both in and out of the U.S., has seen historically. For hubs like Houston that have the infrastructure, it really does seem like that perfect storm for more expansion.
Wow. Okay, so summing this up, medical tourism within the U.S., with places like Houston at the forefront, it's not some small side business. It's a major growing industry.
Definitely. Driven by complex global health needs, economic factors, and this really intricate support system that's been built up around it.
A whole ecosystem designed to cater to people traveling often huge distances for very specialized, sometimes life-saving care.
And maybe the final thought, drawing from the sources, is just appreciating the immense stress these patients and their families are under. Traveling so far, facing serious health issues. And it really highlights how vital those logistical supports are. The coordinated city services, the housing providers who show real empathy. They aren't just side notes. They're absolutely essential to making that incredibly difficult journey possible and maybe just a bit more manageable.
It's a good reminder that healthcare isn't just what happens inside the hospital. It's tied to these really personal journeys and this whole web of support outside those walls.
Exactly. It's a much bigger picture.